So the stars really aligned with this whole entire project from early on when Faith Mulira came into the lives of the Crouches and took care of Nancy's father. And she shared with Gordon and Nancy that she wanted to give back to her community. And the way she wanted to do that was through a clinic, and she had some land. And the Crouches really developed a wonderful relationship with Faith, traveling to Uganda with her and seeing the needs of the people and really what Faith wanted to do for them and what her vision was for her clinic, which was to provide health care to everyone and anyone who needed it, whether they could afford it or not.
She loved children and she loved her community. She wanted to see that community grow. Especially in the health services.
Both Faith and I just truly had this vision and the faith that with God's help and with us trying to do what we felt called to do, that it would all come together. And we are thrilled that it has.
The Faith Mulira Healthcare Center officially opened its doors in January of 2011. The clinic serves as a living testimony to Faith's life of sacrifice, courage, and service to others. In June of 2018, the Masooli Project sent a team of 5 to tell the story of the clinic. This is their story.
It really is important to have a boots on the ground presence when you are managing these types of healthcare operations and ventures. So that was really our primary purpose this time, to go and to get an objective and subjective view of what was happening there. The other piece of what we wanted to accomplish was relationship building. That is really the fundamental piece in any one of these ventures. If we don't have the relationships, we're not going to be able to build the trust. We're not going to be able to build the capacity or the sustainability again.
Many, if not all of us, have continued to keep in touch with folks that we came to know there, that we have come to call those people friends, as well as being colleagues, and it fundamentally transforms the nature of our work together.
The Faith Mulira Healthcare Center is a Level 3 healthcare facility registered and licensed by Uganda's Ministry of Health. The clinic provides general outpatient services and reproductive health services with an emphasis on meeting the needs of the poor. They regularly conduct community outreach programs providing a range of services, including health screenings and education, immunizations, testing for diabetes, hypertension, and HIV.
They are just struggling to get
Just to get enough to eat, yeah.
They're struggling.
Do you have to pay fees to go to school?
They pay school fees, and
Yeah.
it's also a challenge.
It's a challenge,
It's a
yeah.
very, very challenge. That's why the condition that they are. Mainly from this area, they keep on getting mostly like malaria.
From the water.
Because it's water from sewage. Those children, they keep on playing in such water.
Her challenge is basically she doesn't have any support in terms of food, treatment, and that is her challenge. And currently she says she has a hernia which is not yet operated, and it is limiting her from doing her daily activities.
We've been able to help those immunocompromised patients, those with HIV. We fix some little time, interact with them in their homes, try to counsel them, to give them intensive adherence counseling to be able to take their drugs properly, such that we'll reduce on the number of treatment failures.
I can't overemphasize the importance of those home visits and that community outreach, particularly in the areas around rural Uganda or any rural resource limited setting, and really the impact that that is going to have going forward.
So it was about the second or third day that we were in Uganda that we got to go participate on a community outreach day with the clinic. It was pretty incredible to see the impact that the clinic is having on the surrounding community. They set up a tent in a poor village and did HIV testing. Heather Duncan brought some inflatable beach balls, and we got to play with the kids and really had this chance to help feed the positive energy.
Our charges are cost-friendly. They are very, very cost-friendly. Reason being, Faith Mulira is in an area which is full of low earners, poor people, as you've seen in the home visits. But we are trying our level best to meet their health needs. We are trying our level best to mitigate our prices, such that they are able to access our services.
So the people there, the quality of the people there that we met, not only through the patients, but the medical staff, really blew me away. It's a very strong board of directors there that we are partnering with to make this all a success. The people that run the staff, Rosalind in particular, just knows how to run a medical clinic. They're very professional. I think they've reached all the people that they need to for immunization days, for outreach days. They know their community and they're supporting it wonderfully.
So it was also pretty incredible to see how the clinic didn't only affect the lives of the surrounding community, but also its employees. Some of the employees that I had the chance to sit down and have conversations with were some of the most inspiring individuals I've ever met.
Well, my name is Gordon Businje Brown. I'm from a very humble background. I'm from a family of 3 and I'm the second.
I'm Sura Patrick. I'm working here at Faith Mulira as the laboratory supervisor. And I joined this place in November last year, 2017.
Professionally, I'm an accountant because I did a bachelor's degree in science in accounting and finance. That is from Chambogo University. Physically, I'm impaired. My left leg is a bit impaired, but that doesn't stop me from dreaming big, you know.
I grew up with my grandma because I didn't see my mom. I didn't grow up with my mom. And my dad died when I was in primary 6.
Their job at the health clinic gave them the means to continue their education.
Faith Mulira has helped me a lot in that I'm able to earn some money to sustain myself, and it has also enabled me to go back for further studies, now remaining with 1 year to accomplish my master's degree in public health.
And continuing their education meant increasing the knowledge and awareness they have of the issues in the surrounding area and the ways of going about solving those issues. And that's an impact that is pretty far-reaching.
Have you ever imagined life without this clinic? I would really thank you guys because you brought this to life, and believe me not, it has impacted a lot of life to the community.
The salary I get from the clinic has helped me meet my responsibilities of paying my bills and helping a few of my siblings and relatives. So this has helped me, but still, in terms of my skills again, still the clinic hasn't helped me much because there are some things I can't do, like more especially the surgical procedures. Still need to bring it on board so that I can keep on practicing my skills.
We've noticed that we are getting very many mothers coming here for antenatal, but they deliver from some other places. So if they provide us with a theater, I think we'll increase on the number of patients that deliver from our place here.
Mothers who are delivering, they are worried because we don't have a theater. They can even ask us, in case I fail, what can I do?
Referring to a theater, we are meaning an operation theater where they can handle surgeries and minor cesarean sections. Right now, we don't have that operational theater, and we have 4 or 5 doctors, and they are not carrying out any surgery. The only thing they do is to see these minor conditions. So a theater will help us to improve the service, and most especially in maternity.
We are rotating on one thing because they are all important, but there are those ones that are very important and very urgent. And the theater is very important and very urgent.
She didn't want to come out.
I know.
Yeah.
Well, why would you want to? You're so comfortable.
She was so cozy in there.
Oh, she likes to take her time.
Oh, it's good. She wants to nurse, I think. She wants to. Hi, everyone. So, I think this was planned for us, but Irene, Faith's daughter, has never seen a delivery at the clinic, and today Faith's daughter Irene saw her first delivery, and I got to see my first delivery at the clinic on the same day. And a healthy baby girl was born. Mom is doing great, and Mom has named this new baby girl Karen.
I think she's jumping with joy at this moment, wherever she is. She must be very, very happy, and she would be, I'm sure she's very, very happy to see that things are still moving and still. We're going to get there. I think she'll still want more because her plan was to have a bigger building, a big hospital. If anything, a teaching hospital. She wanted everything for the community.
First and foremost, I would like to thank our US board, because if it's not your support, I don't know whether we will be here. The support you give us has really enabled us to keep moving. And the Ugandan board, well, I'm very glad that they spotted me as an individual and they saw my characters that I would work for them.
It's not just a medical clinic. I believe they're serving their community as best as anybody can, so I think our job is to support them financially as much as we can as well.
That clinic is impacting on people. When I see the number of children, yesterday I was told 100 children got immunization services. That's a contribution to their life. By attending and by providing immunization services, there are many children whose lives that we have saved.
I think what we really discovered when we traveled to Masooli, the 5 of us, we discovered the enormity of the world's problems in a microcosm. Things like disease burden for children under the age of 5, statistically, they don't survive past 5. And I think of now baby Karen, and I think about what that is going to look like for her. She doesn't have a good chance of surviving past the age of 5, but we can do something about that. We can provide healthcare services to children who die from dehydration. We can provide services in the community outreach, and reaching people who have HIV/AIDS and encouraging them to be compliant with their treatment. We can provide services at the clinic for mothers who want to deliver their babies safely. The help that we can give to these people is immeasurable, and I think that when people get frustrated and think that they can't do something, through the Masooli Project they can.